So welcome and good evening. My name is Dr. Ted O'Connell. I'm the program director at Kaiser Permanente, Napa-Solano. This is the first of what will be a whole series of virtual open houses where hopefully we'll be able to share with all of you parts of our curriculum, kind of some of the things that we think make us unique and are also parts that are really core to what we're doing. And then we hope that we'll also be able to leave a little bit of time to answer your questions as well. The topic today is community medicine, health policy, and advocacy. I'm the host, but we actually have 4 facilitators from our faculty group who are going to be running this session. Dr. Tessa Stecker is a core faculty member with us. She is the regional director of our community medicine and global health fellowships and the director of our regional elective in health policy, in addition to a number of other roles. Dr. Rossan Chen is core faculty, is one of our community medicine co-leads and focuses a lot on advocacy work, and is president of the Solano County chapter of the California Academy of Family Physicians. Solano County is where our medical center sits. Dr. Francisco Dorado is a core faculty member as well and is also one of our community medicine co-leads and has recently taken over as director of our medical center's mobile van, which is currently being built. So a very exciting project. And finally, Dr. Emily Fisher is a member of our teaching faculty. She is a graduate of both our residency program and our community medicine global health fellowship. And Emily is doing a lot of work on homelessness in our community, and we'll be telling you about that as well. I'm going to I'm letting some other people in here. I'm going to encourage all of you to use the chat function if you have questions as they come in. We'll kind of hold those until we've given an overview of what we're up to in the areas of community medicine, advocacy, and health policy. And then we can either kind of read those questions out, or if you're comfortable turning your microphone and your video on, we can just kind of call on you and ask you to pose your question to our panelists. So with that, I will turn this over to our very talented faculty group.
Thank you, Dr. O'Connell. Welcome, everyone. My name is Rossan Chen. I'll be spending the first 10 minutes or so describing our community medicine global health curriculum as well as our advocacy curriculum. So I'm going to share my screen. Okay, I think I need...
You need permissions.
I need permission.
Oh, goodness. Let me figure out how to give you permission for that.
If you go down to the share screen functionality and it'll allow you to.
That should give you permission there, Roseanne.
Okay.
Sorry about that.
No worries. Okay, can you guys see my screen? Good, okay, great. Let me put it in presentation mode. Okay, so this is very similar to the PowerPoint that we give to our residents on their first, during their first month of residency, and this describes our community medicine curriculum. So first, who we are. So Dr. Dorado and myself, these are pictures of our families. So I've been with Kaiser Vallejo for the past 6 years or so and part of the residency program for about 5 years. And I am an outpatient family physician. I do full spectrum family medicine, including prenatal care, lots of procedures, office-based procedures. And we have another, I think, session coming up on office-based procedures in the coming weeks. So tune in for more information on that. Before I had my child, I was doing a lot of work in the ER and hoping to pick that up soon once things settle down at home. And then Dr. Dorado, you want to introduce yourself? And unmute. Oh, you're still unmute. You're still muted.
No, you can hear me okay?
Yeah.
All right. I knew that was going to happen. Again, I'm one of the co-leads for the community medicine curriculum, and that's a picture from a while ago from my children and myself. My wife is the one taking the picture. And I do full scope outpatient family medicine, including prenatal care, and then we'll be expanding out to the community. And I'll expand more later. I'll let you keep going, Roseanne.
Okay. Great. So a large part of our curriculum is the Thursday afternoon academic half day. So we have approximately half of the time allocated for the year to community medicine and global health topics. So that includes, racial implicit bias, community health resources. We have a few sessions we call MacGyver medicine, which is we give you clinical scenarios and you have limited resources, and how do you handle the situation? Because the idea is that we want to give our residents the tools to be able to practice medicine, not just within Kaiser, but outside of a Kaiser system. And if you guys are familiar with the Kaiser system, a lot of things are, they make it very easy for us, a lot of smart sets for ordering antibiotics, that sort of thing. And so we challenge our residents, and sometimes, sub-Is to be able to practice in a community health setting, a global health setting. And so that's what we call MacGyver medicine. We also have sessions with Dr. Jones and Dr. Stecker on global health. And every December, we do an entire afternoon at Dr. Jones's home in Vacaville. And we have usually one of our community partners, Vilma, from the Vallejo People's Garden, come, and we cook what we pull from her garden, and it's just an opportunity for us to connect and eat fresh vegetables and talk about how food and medicine are connected. To be determined how things will play out with COVID this year, but that's what we've done in years past. And every year we choose a theme for the year, and so this year we chose advocacy for community health. And part of the academic half-day time is dedicated to project time. So each class is expected to come up with a class project. It can range from a health education, like developing a curriculum for health education in the community, to doing research. And typically the research involves chart review. We have a whole department of DOR's Department of Research, and they help us with clinical research questions. They are set up to help residents with doing research, and they're very, very supportive. So part of the time is dedicated to working as a group, because we understand that when residents are doing their clinical rotations, they're not often able to collaborate together on their projects. And the idea is that it's a longitudinal project. So they start planning for it during their first year, talking to different stakeholders, doing needs assessments, and then coming up with the actual project in their second year, and then implementing it in the third year. And this is all guided by our research project manager, Kat, who I don't think is on the call, but she's great, very, very, very helpful and friendly.
She's on the call. I saw her.
Kat, do you want to say a few words about the research project or the community-based research? And if you're not unmuted, you have to unmute yourself.
Hi, sorry, I was muted. Apologize. Can you guys hear me okay?
Yeah.
Okay, great. And I apologize also if you hear barking or whining in the background. It's from my dog. So yeah, thank you, Roseanne, for introducing the project. You covered basically everything of what we can offer to our residents. And I just wanted to mention that we are piloting kind of a new angle of what we're doing with our scholarly work that involves a lot of community-based participation. We call it community-based participatory research, or health promotion within the community, working on a longitudinal project such as grant writing that involves grant writing and implementing some type of promotional intervention in the community. So we just started that out this year and hoping to continue that moving forward with our future classes.
Great, thank you, Kat. Okay, we also partner with the Vallejo City Unified School District In the years past, the residents have gone to the teen clinic. They've given health education talks during the back to school nights. We've even had residents give the graduation speech and, you know, attend job fairs and that sort of thing. With COVID, there have been challenges, of course. The school's not in session on site. And so we've been doing remote health education, mostly for the elementary schools, and it seems to be working well, you know, on hand hygiene and what is COVID and how to maintain participation and interest in virtual learning environments. Another part of the curriculum is that the residents attend La Clinica in North Vallejo. It's our sister site. It's a federally qualified health center, FQHC. And this is in lieu of one of their family medicine clinics, because we consider, you know, the patients in our community, all of our patients. And so whether they're being seen here or in La Clinica, they're still part of ours. So we count this as part of their family medicine clinic. So approximately, since there's 6 residents per class, approximately every 6 weeks, each resident will go and see patients with our preceptors out in the community. Another opportunity that Dr. Stecker will mention more about is KP SOARS, which is how we as Kaiser Vallejo give back to the FQHC for you know, allowing our residents to rotate there and provide access to much needed difficult specialty services and diagnostics. Residents can moonlight at the urgent care at La Clinica. There is a prenatal elective. They have a sister site just next door called Great Beginnings, which is their where they see all their prenatal care. And so it's a nice opportunity for residents to get a sense of what it's like to practice prenatal care outside of Kaiser. They have a Suboxone clinic, if anybody's interested in MAT, as well as a transitions clinic, which is a clinic especially for people who are recently incarcerated, who have been released and are now living in the community. And so a lot of those folks are just discharged with 1 month's worth of medications, and they're kind of left on their own to figure out everything. And so these special transitions clinics are helping these targeted population. In the years past, residents have gone up to Olay Health in Napa and have done farm workers health fairs to do screenings for blood pressure and diabetes and that sort of thing. And the resident will, or sorry, the fellow sees patients there, and then if it coincides with the resident's community medicine curriculum, then they'll be paired with the fellow. So we have a dedicated 2-week community medicine rotation that the first year and the 3rd year residents have as part of their academic year. And this is a sampling of some of the activities that the residents get to do. And the residents are allowed to choose their interests. So we reach out to them about a month or 2 ahead of time to ask them like what they want to focus on. And we had a resident recently who's really interested in MAT and is actually going to go into addiction medicine for her fellowship. So she did a lot of, you know, Suboxone clinic and methadone clinic. But this is a general schedule. So a lot of it's working in the community in terms of health education, the People's Garden. We send them to the Superior Court here to see what kind of cases are being heard. Of course, they still need to maintain their clinic. And there's some evening activities such as the City Hall meeting or City Council meetings. Sometimes there's Board of Education. It really depends on the opportunities that happen to be going on during their community medicine rotation. But it's highly customizable. Occasionally, we'll show snippets of this PBS series on natural causes and just discuss how, you know, unconscious bias and racial bias are contributing to inequality in healthcare. Their STFM kind of leadership courses. This is somewhat new, and unfortunately, I think it's been on hold with COVID. But there's a prison in Vacaville called CMF. I think it's California Medical Facility. And it's a state prison that is specifically houses more medically vulnerable prisoners. And they have, and they're actually, it's a great center for teaching. Residents from all over Northern California are able to rotate there, anywhere between a 2 and 4 week elective. And they have, you know, a Hep C clinic. They have one of the only hospices in a prison. They have HIV clinic, a lot of mental health, a lot of procedures, and you kind of get a sense of what it's like to be a primary care doctor in a prison. And so several of our residents have taken advantage of that opportunity. Dr. Fisher will talk a little bit more about the Vallejo Mobile Health, which is our outreach to the homeless population here in Vallejo. And then a little bit about advocacy, because I'm running over, sorry. So this has also been a little bit on hold, but still very much of interest among our residents and our faculty. So we're involved in the California Academy of Family Physicians. There's an advocacy meeting every March in Sacramento. And we've submitted resolutions every year to try to get the CFP to adopt a certain stance on a particular policy. We've had residents attend the National Summit in Washington, D.C. Dr. Stecker may talk a little bit about the resident elective and health policy, which just happened. And it's a 2-week elective open to any Kaiser resident to attend. And then we have chapter meetings about every 3 months, pre-COVID. This is a list of some of our local community medicine partners. A list of our global health partners. I think there will be future sessions on global health, and perhaps Dr. Fisher and Dr. Stecker can talk a little bit about that. Great. We'll save questions for the end, actually. So now we're going to have Dr. Stecker talk about her roles.
Thank you, Roseanne. You did a lovely job of just outlining the some of the basics. If you want to stop sharing your screen, there we go. So I don't have a formal slide deck or presentation, but I just wanted to provide a little bit more detail about some of the items that Dr. Chen referred to in her introductory remarks. So first of all, welcome all of you. For those who I haven't already met, I'm Tessa Stecker, family medicine physician, part of the faculty, and have regional responsibilities regarding the Community Medicine Fellowship Program, as well as the Health Policy Elective. So I'll give a little bit more details about both of those. So the Community Medicine Fellowship Program is an opportunity for physicians who have finished an internal medicine or family medicine residency program to do a 13-month fellowship in vulnerable population care, with the goal of really providing needs-based care to the community and becoming creative with solutions of how to provide high-quality holistic care to our patients and community. So our community medicine fellows spend part of their time, most of their clinical time actually out in the community at federally qualified health centers and community clinics, a little bit of their time at the KP clinic, and then a chunk of their time running some community programs, initiatives, and taking part in scholarly activity work. So we are fortunate that our program, we have a community medicine and global health fellow, and she works at both La Clinica and Olay Health. And that, as Dr. Chen mentioned, is an opportunity for our residents to spend even more time at the community clinic. And we have one third-year resident this year is actually creating a community clinic elective, where she's going to basically spend the majority of her time with the fellow at the community clinics, because that's where she would like to work when she graduates. Our fellow also is the primary person who runs our KP SOARS program. KP SOARS stands for Kaiser Permanente Specialists Offering Access to Referral Services. It took me a long time to remember what that acronym stood for. But essentially, what happens is that in our community in Vallejo, there is not a county hospital. So some of you may work in places where there's a county hospital, which becomes sort of the catch-all for people who don't have insurance, for people who need access to specialty care, even though the wait times can be considerable. So because we don't have that, we have a special partnership with La Clinica where they can refer patients to Kaiser Permanente simply to access specialty care. So they can see the cardiologist and gastroenterologist, they can get much needed surgeries and diagnostic studies. And our residents are the ones who are the primary people who evaluate the applications that are sent once monthly from La Clinica. And then as a group of residents and faculty, we make a determination of the best way of plugging in the patient to the care that they need. And our residents actually assume the responsibility of following individual patients through their care at KP. It's an incredible way of giving back to the community. It's also an incredible way of really understanding how important it is to take thorough history and physicals of our patients, and of really thinking about the ways that we get patients the care that they need, and really thinking about some of the challenges that our patients face in terms of transportation, in terms of language barriers, in terms of finances. The wonderful thing about KP stores, it is zero cost to our patients. They do not pay for any lab services, diagnostic studies, any of the specialty visits, any surgeries that they get while they're a KP Source member. Additionally, even though it's a short-term access program, if a patient is sent to KP Source and is found to have something that needs more long-term care, for instance, we've had patients who've had biopsies that turn out to be cancers, they are followed throughout their entirety of their care. Chemo, radiation, surgery, the whole deal, without cost to patient. I cannot underscore how important this service is to our community members and how proud we are that our residency program gets to take a part in this really valuable service, and our residents get to be really physician leaders in this realm. Our fellow also manages the July Global Health Trip for our R3s, as well as the multidisciplinary group that goes down. I won't spend too much time on there because we have a different session on global health. And the other thing that I did want to spend some time talking about, the 2-week residency elective and health policy that Dr. Chen mentioned. We did just finish that about a week and a half ago. We had 38 course participants this year, residents and fellows from KP Northern California programs, as well as 7 community medicine fellows from KP Southern California joined us as well. It was our first virtual health policy elective, but it is, and Dr. Fisher actually took part in this when she was a fellow as well, so she can speak to it from the participant standpoint. But we cover all local, state, national, and global health policy topics. So everything from health economics and health law and the ACA and understanding health insurance and the history of health insurance and healthcare in this country, to doing deeper dive in topics such as migrant farm worker health policy, women's health policy, transgender health policy, climate change policy. There's a lot of a focus is on looking at upstream factors that affect the care of our patients, and thinking about the care of our patients, not just in clinical care, but of the entire system. And I know that many of you are very much interested in this work. It is an open opportunity available to all KP Northern California residents and fellows to apply to for 2 weeks. There we have site visits, they have a policy analysis project. It's just a wonderful opportunity. And then lastly, I just wanted to touch a little bit more on our curriculum focused on diversity, equity, inclusion, and anti-racism. So as Dr. Chen mentioned, there is some time set aside during the academic half day of community medicine to do 4 workshops a year with the resident physicians in different topic areas. So looking at the historical legacy of structural racism in this country, to thinking about microaggressions, code switching, intersectionality, and privilege. So we cover 1 or 2 topics at a time and do a deep dive workshop style, focus on self-reflection, small group discussions, and large group discussions as well. We've also expanded, we just recently had a joint resident and faculty workshop where we were all able to get together to do a little bit more exploration in terms of our own identities, affinity bias, and also looking at some of the historical legacy of racism in this country and how that has contributed to disparities, particularly for people of color. Our faculty are currently all taking part in some various workshops designed by UCSF in this realm as well. And we are actively looking at all the ways that we can integrate this, not just within the community medicine curriculum, but really throughout the entire curriculum of the residency program. One of our faculty members, Dr. Flaxman, has already done this within the women's health curriculum. There are videos and readings specifically related to reproductive justice that are now embedded within that program, and we're hoping to expand that offering. So I will stop there because I've taken a while and I went through a lot of information. I will pass it over to Dr. Fisher. I believe she's going to be sharing a little bit more about the community endeavors.
Thank you, Dr. Stecker. So it's interesting because because I have been a part of this program actually since medical school. I did my sub-I at this residency. I could probably talk to you all for hours about the work that we've done and kind of all the different perspectives I've had the privilege of being a part of. I will just say, to touch on my experience as a resident with the community medicine curriculum, at that time it was working a little bit differently, but we were able to partner with the elementary schools and work on a mindfulness-based curriculum for teachers to provide some teacher support. And we actually partnered with the local psychology, the Kaiser psychology PhD residency program to facilitate some of those classes, which were fairly well received. But that was a really great experience and a great learning experience, and getting to kind of have our first networking into the community, particularly as residents, when it's really easy to get lost in intern year and not sleeping and all of that fun stuff. And then as a fellow, I wish that could have been my job for the rest of my life. And I'm not saying that just because Dr. Stecker is here. So the fellowship in Vallejo is really beautifully built out, where there's multiple projects already running. So as a fellow, I actually ran the KP SOARS program for a year and was working at La Clinica and Ole Health and precepted patients or precepted medical students and residents in both of those locations. And at La Clinica, that is also a procedure clinic. So the residents get a lot of good experience in like Nexplanons and IEDs in that location, and toenail removals in particular. And we also helped to lead a program with the Napa Valley College called the Medical Scholars Program, where we run a leadership forum series for students who are interested in entering the medical fields. Many of these students were kind of first-time college students or the first people in their family who had gone to college. And so I got to craft some of the curriculum for that. And we got to talk about empathy and emotional intelligence. And I also had them come out with me to the encampments to see some of our homeless patients. And they actually were really helpful in some of our kind of initial needs assessments and research into what this population needs. I'll come back to that in a moment. I don't want to forget that the Global Health in Honduras trip is a big part of that fellowship, although now I remember that is a different evening, so never mind, I will save that. But that leads me to a big component of my fellowship time was putting together Vallejo Mobile Health, which is a street outreach team intended to bring free medical care to people without homes in Vallejo. I'd spent most of my fellowship year setting it up in partnership with a local organization that works with this population called Vallejo Together. And the Toro University medical students, 3 of the executive board members of the student-run free clinic, we kind of all worked together to set this up, where we would go out mainly with Vallejo Together and then with a local church. We would go out to a different encampment each month, and eventually started partnering with a large church that served a free breakfast once every Saturday. And so there would be live music and free haircuts, and then we would show up with our tables and chairs and wound care supplies. And a lot of what we would do is wound care is, oh, you're supposed to be on this medication and your blood pressure is 200/100. Yes, let's get you back on this medication. And then a big component of what we want to do with Vallejo Mobile Health, based on the needs assessments that we've done with people, is try to act as a resource facilitator, because a lot of these people have insurance or technically have a primary care doctor somewhere that they just aren't accessing, or they would have the ability to be on food stamps or get on the Section 8 wait list, but they just haven't had the resources or the support to do that. So we've been trying to build that out a silver lining of COVID has been, if any of you are familiar with the Project Roomkey program here in California, it's a statewide initiative where California is providing funding to house people without homes who would be high risk were they to get COVID, to house those people in hotels. And it's run locally at each city level. And when it was getting started in Vallejo, they needed help with the medical part of this. And so Vallejo Mobile Health was poised to jump in. And so we are partnered with another organization, also out of Toro, actually, organization called One Love Center for Help. And we're partnering to provide the free medical care to the homeless patients housed at the hotels, which has been a really incredible experience because there's also a case management team and a mental health team and a county eligibility team all there on site. And so it's been really exciting to see what we can actually do when we're moving forward. From a residency standpoint, I'm always trying to get residents to come and join us in these endeavors, because I know that when I was a resident, this is exactly the kind of thing I would have loved to do. And so always trying to bring people in. Vallejo Mobile Health also in this last year has been part of a national initiative as part of the, and Dr. Kano can correct me when I get this wrong, Alliance for Independent Academic Medical Centers, which is a group of hospitals which are not actually medical schools, but who do teaching. And they have cohorts of projects, many of them kind of quality improvement type projects that we all come together over a year and a half and kind of help each other through, particularly around teaming and multidisciplinary teams. And so Vallejo Mobile Health through the residency has actually been a part of this cohort over the last year. And one of our third-year residents, Dr. Franco, has been on our team to help along in that project. One last little bit, and then I will stop talking. In kind of formalizing Vallejo Mobile Health, my husband and I have actually also developed a nonprofit called Fourth Second that we're kind of housing Vallejo Mobile Health in. And that nonprofit is we're working on things in the community of Vallejo, ranging from getting churches to use their land to house people in the community, to setting up police oversight systems and setting up an alternative emergency response system. So those are all things also in the pipeline that I'm always thinking of residents and how we can include people. And you can ask Kat. I'm constantly using the public health interns and anyone who will come and work with us. So hopefully that will be some of you guys. So I will stop. And I think now we're opening for questions.
That was an amazing overview, everybody. I hope all of our participants, our guests here, are hearing just exactly how much we're doing in the areas of community medicine, health policy, and advocacy, and how many different venues and types of training around this. There's some really good questions coming in here, and we will kind of just try to take them in order. Some of them have already been answered in the chat, but could probably use a little bit more context. There's been a couple questions about MAT training and addiction medicine, and I'm happy to take a stab at that one. So all of our residents have a rotation in addiction medicine. We were fortunate last year to also receive a grant from the California Academy of Family Physicians to expand our MAT training. And so as part of that, we essentially expected all of our faculty to get their X waivers to move everybody towards being comfortable with Suboxone prescribing. And so now all of our core faculty do have their X waivers. We also provided time for our residents to do their training as well. So all of our residents have received MAT training, and that is now built into the curriculum for each class of residents that comes in subsequently. We have partnered, fortunately our addiction medicine department is very collegial and has really created a partnership with us. So we have a cohort of residents who are really interested in prescribing. And as we mentioned earlier, one of our current third-year residents is matched into an addiction medicine fellowship. So we have a cohort of residents that really want to learn how to prescribe, that are our first kind of pilot group, and are doing that where they are able to call over to the addiction medicine department and get any kind of precepting they need around that. And so we have a cohort of patients who are receiving Suboxone prescriptions through the clinic. We're working on expanding that. And we've actually had a couple of starts in the hospital as well on our inpatient medicine team. So it's still kind of in its infancy, but growing nicely. There was a question about, do we have legal services and things like that? We don't, and I actually don't know if the addiction medicine department does or not. We do have access to social workers and things like that. But this is very much in evolution and one of our big priorities. We also got one other question. This will be the last one that I try to answer before I hand it over to the team. And the team can also add any kind of nuance to this that you would like. But there was a question about the executive order on combating race and sex stereotyping. Let me just say that the AAMC came out with a very strongly worded statement related to that is very much in alignment with what we're doing. And basically they said organizations shouldn't follow this, so we should actually be providing more training and education around equity, inclusion, diversity, and anti-racism. And that seems to be very much the way our organization is going. I will say this morning we had a regional GME session on anti-racism. So, and I will also say this executive order is already being challenged in court. So this is going to get hung up for a long time, and hopefully will just go away. But we are very much as an organization, and definitely as a residency, proceeding with training in these very important areas. With that, I will turn this over to the community medicine team and let you field these questions however it works best for you as a group.
If no one has a question right now, I was just going to expand a little bit on one of the topics that Rossan had mentioned, was that our mobile health clinic that will be starting at the beginning of the year, hopefully in January. It's a 2-room, 40-foot truck with it'll have one physician, 2 nurses, basically providing primary care outside of our walls, out in the rural areas of our 2 counties that we serve. And so we're in Napa and Solano counties. Some parts are very rural. There's farms, and there's also other areas where it's more urban and factories. And so we'll try to go out and expand and try to capture patients who usually wouldn't come into our clinic or can't for whatever reason, due to work restrictions, time constraints, or just it hasn't popped up in their mind to provide primary care to our regular Kaiser patients. And so there's a lot more I could expand upon on that, but I just wanted to add that'll be another component. The hope is that residents will be able to go out and work with a preceptor, seeing patients in the clinic.
Looks like we got a little bit frozen.
Yeah, there's lots of questions that have come in the chat. I think we can start synthesizing some of them. And as Dr. O'Connell said, we did try to keep up and respond when we could, but you guys are fast. Which is great. This is what this session is supposed to be about. So a little bit more about La Clinica. They serve a very diverse population because Vallejo is the most diverse city in the United States of America. Just in terms of the sheer numbers of different groups that are represented within the community, but also it's an interesting community in that there really isn't one majority group. So a lot of times communities will have one group that's majority, like predominantly Latinx, and then a smattering of other groups, but it is fairly equally distributed between white, Latinx, Asian American, and Black population. And so that is definitely a wonderful opportunity to provide to such a culturally and ethnic diverse group of people. They do have telephone interpreter services available for those who do require other languages, not only Spanish or Mandarin as you commonly see in California, but all sorts of other languages as well, just due to the diversity of the population. Regarding KP SOARs, there were some questions about that. We do accept all patients into KP SOARs. In fact, because of the fact that California did such a good job with ACA expansion, and a lot of people in California who previously were uninsured did qualify for Medi-Cal, which is our version of Medicaid. Predominantly, we see patients who are undocumented through KP SOARs. However, we also see sometimes people who are underinsured or have gaps in between health insurance coverage. We recently renewed our contract through 2025, and we actually increased the financial threshold. So anybody who now makes up to 350% of the federal poverty limit can actually be part of the program, and we leave it up to La Clinica to do the assessment of eligibility. So when they send it to us, we don't do a second eligibility. We just take the patient and we assess to see if they should be, if they're an appropriate candidate for the program. Regarding the health policy elective, there were some additional questions about that as well. We just completed our 4th year in Northern California. Southern California, I think, has done 5 years total of the program. So we are actually now starting to see where our graduates are heading off to. We have people who are involved in leadership positions within medical education, within diversity, equity, inclusion, anti-racism work, within community work, people who have taken positions in medical organizations such as the CAFP or California Academy of Family Physicians, or the CMA. We have people who have published letters to the editor and op-eds coming out of the program. In fact, I just edited one last week of a participant who completed the course this year. So there are a ton of ways that people take the information they're learning, their education, and employ it either in their personal lives or in their professional careers and endeavors as well. There was a question regarding examples of health policy issues that residents were involved with and what the outcomes were. And I think that, Roseanne, you maybe want to expand a little bit in terms of the resolutions for the CAFP, because I think that's a lot of the work that at least our residents have been involved with.
Yeah, in the past, residents have submitted resolutions ranging from greening the hospital to resident burnout and improving wellness to, soda tax to, so it totally depends on the resident. Or, we also work, it's actually through the California Academy of Family Physicians Napa-Solano chapter. So it's open to any physician who's practicing or living in our county, and the medical students from Toro. And so last year we had more participation from our Toro medical students. And so they submitted, I think, one resolution each. There were 2 of them. And then Dr. Stecker and I submitted a resolution on paid parental leave. So, every year we try to submit at least one, but it's usually more than that. And if I can convince the residents I always give them time to practice. And if they want to develop that into an actual resolution to submit it, that, we're totally supportive and happy to help them with that. And if they do submit, then they get to use some education leave to go to the actual conference and some funds as well.
There was a question about time at La Clinica. So in addition to the every 6-week continuity experience at La Clinica, it is also an experience that is built into your community medicine rotation as well in your 1st year and in your 3rd year. And the residents also will work with the fellow at the La Clinica Procedure Clinic, which we host every Wednesday afternoon. And that's an opportunity to do minor procedures, ingrown toenails, steroid injections, EMBs, IUDs, Nexplanons, the whole gamut of FP office procedures. And is there any plan in the future to expand KP SOARs and connect patients with specialists outside the KP system? Great question. All right, so when we had to renew the KP SOARs contract, I really learned the nitty-gritty of the legal a partnership and all that what goes into it. So the way that KP SOARS is funded is it actually comes out of KP's community medicine financial assistance budget. And the payment for the services of KP SOARS patients is grouped with other programs such as Operation Access that provide services to people outside of our organization. And this actually helps to maintain the nonprofit status of our organization. So the services that we provide are directly within KP because that's where the funding is coming from. So for the moment, we don't have an opportunity to connect people outside. However, we are very fortunate in our service area that we can connect people to pretty much every adult specialty service out there. And actually, KP Santa Rosa is in the process of developing their own similar program right now based on the program that we started. So it's great that this is going to be extended and other KP sites can potentially address their needs of their community in this way as well.
I think there was a question about alternative emergency response through Vallejo Mobile Health. And just to speak to that, so a brief snippet, the idea of this is that we're getting the people out to emergency situations that actually can help the emergency situations and not make them worse. And so often that means trying to divert calls from police response. And so the idea is to get an EMT or a crisis counselor out to appropriate calls. Right now, this is still very much in its infancy. We've been working with the city to contract another organization that runs a similar service actually in Oregon. And so right now we have contracted them to help us figure out how to set this up in the city. Vallejo Mobile Health, I think, will be part of kind of a network of organizations in the community that will be providing some support. Because a lot of it is stuff that we are already doing. So things that they respond to often are wounds that need checking on, or wellness checks of this person who's sitting on the street that people are worried about. And a lot of those end up being our homeless patients. So some of that we're doing a little bit now, but the actual formalized team, we are in the creation stages of right now.
Are there opportunities for residents to get involved with clinic or hospital leadership boards or committees? Yes. The simple answer is yes. There are a ton of different opportunities that the residents have to be a part of committees within the hospital, but then also within our residency program as well. So for instance, yesterday we had our tri-annual program evaluation committee meeting, and that's an opportunity for us as a residency program to evaluate every component of our residency curricula. So looking at everything from the hospital-based service to family medicine clinic, to the nephrology rotation, to the ICU rotation, and really thinking about where are the areas that we're doing well and what are opportunities for growth. This is a dynamic process. Both residents and faculty are involved. There are 2 resident representatives from each class that sit on this committee. And I can tell you from personal experience that there are definite changes that go into effect every single year based on what comes out of that committee. It is a tremendous opportunity for residents to be a part of shaping the residency program.
I'm seeing another.
Fisher, you
got
a question.
So the police oversight, so that's kind of more part of our nonprofit work. So, and that I do in partnership with my husband, who has been working as a community organizer essentially since we moved here for residency. So he and one of our council members have been working with someone who had started a police oversight committee, or he's going to get mad at me that I forgot the name of this, but it's in Denver, where it's kind of a hybrid panel of community members and of people from the police department, where they're both kind of looking backward and forward. So they really emphasize the importance of both acting as kind of a like review board for past misconduct, but also looking at moving into the future of kind of community outreach or other policies that we can help with the police department to prevent issues going forward. So that's kind of part of a larger spectrum of programs that is kind of also this. A lot of this we've been working on for a couple of years, but has really come into fruition in the last 6-7 months. I think a lot because of the climate that we're in right now. People are definitely more motivated to move things forward. So I think right now it's looking like it would be a hybrid committee of a community board and members from the police department. And we're really working on setting up kind of the community task force to actually set this up and get it going.
I think we caught up with questions, but there was such a flurry. So if somebody's question was missed in all that, please just feel free to either retype it or unmute yourself and ask it.
Hi, Dr. Stecker.
Hi.
Yes, I'm Abigail, fourth year from the University of Arizona College of Medicine in Tucson. My question is actually for Dr. Dorado, and I guess Dr. Fisher also, in regards to the Vallejo mobile health van for patients who might need either more frequent follow-ups or specialized care. Are there plans in place to get them to either the city or to clinics that might be closer due to the issues with transportation? And then I guess the other part of my question for that, if there are patients who need prenatal care, are there also plans to help them not only get the care with each visit, but also to deliver with like the residents or the KP system?
Just to clarify, we're two different programs, but we work together. Emily's group is a nonprofit, and she is really out in the community. Has been doing it for a couple of years now. My program is a Kaiser mobile clinic on wheels that has not started yet. It will start in January, knock on wood, and we'll be out in the community serving mostly Kaiser members. We hope to expand that to non-Kaiser members, but that's yet to be determined. Emily mostly focuses on anyone that's unhoused, although we hope to work together. And I've worked with Emily and others as a volunteer and being out there with the students and doing things. But yes, it's two different programs, but it's similar names.
Yeah, and ours changed names about 3 times. So everyone's still learning it a little bit. Yeah, Dr. Dorado has been a wonderful volunteer. Actually, also Dr. Simquick, who I saw on the call, and Dr. Stecker. I've made them all come out. So when we see people out in the community, it's, I think to your point, the follow-up is really important because we can fix somebody for 5 minutes, but then if there's nothing else after that, it doesn't really help much. So we do try to figure out ways to set them up with a home clinic. And interestingly, a lot of these patients actually, or more than you would think, are actually Kaiser patients. And I'm actually working on getting a lot of them moved onto my panel for easier follow-up. So basically for anyone we see, we try to figure out where is their medical home going to be and how can we facilitate getting them there. And a lot of what we've learned is that lack of trust in the healthcare system is a big reason why people don't follow up. And so sometimes we're able to kind of piggyback the trust that they've gotten in us to get them to go to see another doctor. When I was a fellow, I was at La Clinica and Kaiser, so it was really easy to say like, oh, well, I will be at La Clinica, come see me there. But through the relationships that I was able to build through that fellowship, we have pretty close ties with some of the other clinics in the community. So I'll kind of call up their technical PCP and give them an update and see what we can do to get them that shower chair or whatever. Now that we're in the hotel, it's easier to move things forward because people are in one place for more than a day. And then I think you asked a question about prenatal patients. I mean, if they are Kaiser patients, then yes, that's relatively easy. But we actually haven't, our program started actually because of a prenatal patient. But we actually have only seen one or two since then, and they ended up delivering in San Francisco.
Thank you so much.
Yeah.
So I think we probably have time for one more question if there is one. I want to be respectful of everybody's time and evening. And if there aren't, then we will wrap. So does anybody have any final questions you'd like the panelists to address?
Hi, my name is Deidreana Lomax. I'm an import at Howard University. I just have sort of a clarifying question, I guess. So do we anticipate the KP mobile clinic to operate similar to Dr. Fisher's, except only seeing Kaiser patients, or how do you anticipate the mobile clinic to run?
So currently the plan is to serve our current Kaiser members that don't access our clinics regularly or who live in rural areas. So that's the current plan. Whether it expands or meets other needs, that's yet to be determined, but that's outside of what we are currently planning to do.
Thank you.
Okay.
Our goal is to perhaps bring them to the schools here in Vallejo and perhaps in the other schools in the county, because so many kids need healthcare, and a lot of them are Kaiser members. And here in the Vallejo City Unified School District, they lost their nurse practitioner recently. She retired, and so they don't have anybody doing immunizations, and so a lot of our kids have fallen behind on their vaccines, especially now with everyone at home and not having that easy access to the school-based clinic. So one of our hopes is to eventually use one of those days to bring the van over to the schools.
And just to clarify also is if some of our patients have Medi-Cal, which is Medicaid in the state of California, if they, a lot of them might have the opportunity to just switch that to Kaiser, and so they could become Kaiser members. The same thing for Medicare. And so then there's a lot of eligibility out there where they could become Kaiser members if they select to do so. Some of them choose to stay with their current provider, and so that gives them options.
Great. I think that was a really rich discussion and a great overview of what our residency program is up to out in the community. So I want to thank our faculty facilitators for putting this together and taking time out of your evening to give this presentation. And thank you to all of our guests, our applicants to our residency program, for being here and being part of this and engaging and offering up such great questions. We will be having these essentially every Wednesday. The schedule is out there. We'll cover other topics going forward, but if any questions didn't get answered here, we encourage you to just go ahead and ask those at future sessions. And towards the end of interview season, we'll have an overall Q&A as well. So we want to make sure that you really get as much information about our residency program as possible and get all of your questions answered so that you're making really informed decisions about your residency training choices. So with that, thank you to everyone, and I wish you all a very nice evening.